No problem. Oh, well, thank you for inviting me, and it's lovely to see so many people interested in learning more about HRT. So I've got 15 minutes, which is not a very long talk, so I'm going to whiz through things, but I will be in the room, the big room, so if any of you have got any questions, then feel free to come and speak to me sort of at the end. So this is a slide just outlining who I am really. So I'm Dr. Unsworth, so I was a GP for over 10 years in Suffolk. But my interest was in women's health, and I developed my interest particularly in menopause. So I am a British Menopause Society registered specialist. I run a private clinic in Cambridge, but I also work in NHS settings in women in the breast unit in Cambridge with women who've had breast cancer, and also in a community gynaecology clinic in Saffron Walden. So really today it's just I want to talk to you about HRT. So HRT is something that I'm really passionate about, and I think lots of women have got a lot to gain from using it, and I think it's really important that you know enough about it so you can make the choice as to whether you think it's something that is going to suit you. I'm not forcing it on people. I think it's something that is a personal choice, but I think you need to know enough about it to make that choice really. So HRT, what are we talking about? So we're talking about two different hormones usually. Most of the time, estrogen is the hormone that's going to really help a lot of your symptoms, but we may need to use it with a progestogen or progesterone as well, and I'll talk a little bit about when that is the case. But what are the different hormones that we use? So estrogen, we mainly use estradiol, which is the main hormone that our bodies use, and most HRT products will contain that. Some of the products might contain some slightly different forms of estrogen, but most of them are, well, these are all synthesized from plant-based products, so soy and yams, and estradiol is chemically the same as your body's natural estrogen that is mainly functioning in your body. The progestogen, so a lot of HRT products will contain synthetic forms of progestogen, so it's not progesterone, it's a slightly different structure to it, but it has the same sort of action as progesterone. Again, these are often derived from plants. But there is a newer, well, it's not new actually, it's been around quite a long time, but there is a product that does contain actual progesterone, which is chemically the same as your body's natural hormones. So if you use a combination of estradiol and progesterone, that's what we call body identical HRT, and that is what a lot of people probably might have heard about now, and it probably is the gold standard that we're using with most people now. I just want to point out it's different to bioidentical HRT. So this is something you might have read about, you might have had a bit of interest in. These are pharmacies that make bioidentical HRT. They compound different amounts of hormone meant to be individualized, but these are not regulated products. So we don't really know how safe they are. So as a British Menopause Society member, they're not something that I would recommend. But we can give you body identical HRT on the NHS. That is a type of HRT that's available. So that would be what I would be encouraging you to think about. So what type of HRT do you need as an individual? So the way I often approach it is to think, have I had a hysterectomy? So if you've had your womb removed, the vast majority of the time you can have what's called estrogen-only HRT. So that's just estrogen on its own. There's a couple of times when that might not be the case. So if someone's had bad endometriosis, for example, we might not do that. But with the vast majority of the time, you just have estrogen. But most people probably haven't had a hysterectomy, so we actually need to give you what's called combined HRT. So it's a combination of estrogen and a progestogen or progesterone. And then traditionally, what we would do is we'd divide this into whether or not you're still having periods or not. So if you're still having periods, we'd often give you what's known as cyclical or sequential HRT, which will make you continue to have your periods sort of once a month usually. If your periods are finished, then we can give you what's known as continuous HRT. So you get both hormones all the time, and it wouldn't make your periods come back. It's really just using this hormones at the same time each day. This is not a hard and fast rule. So sometimes I might use continuous HRT in someone who's still having periods. But as a general rule, that's kind of what we do. The reason for the progesterone is to protect your womb lining. So if you get given estrogen on its own and you still have your womb lining, it can cause it to thicken and it can increase the risk of developing cancerous changes in your womb. So that's why we give you progesterone to stop that from happening. The estrogen is the hormone that mainly helps with your symptoms, which is why I'm wearing this necklace. Estrogen is the key really. So What products have we got in the UK? So there's loads of different products available when they're available. Sadly, there have been some supply problems. I'm sure lots of you have probably seen that in the media, which has been really challenging and really frustrating. But generally, there are lots of different products available. So there is going to be something that will suit most women. There isn't a one-size-fits-all though, so I do think it is quite an individual process. But there's a combination of things. So the tablets that contain either just estrogen, combination of estrogen and progestogens, or progesterone on its own. There is gel, so this is estrogel, this picture here, that's quite a common product. That contains estrogen and you apply it directly to your skin. There are patches, so these contain either just estrogen or they can be in combination as well. The Mirena coil, which is this little T-shaped thing here. Some of you might already have that for contraception or bleeding problems. That can actually be used as part of HRT. There's a spray, which is quite a new product. It's just been around for a couple of years now, and that's an estrogen spray. Again, that delivers estrogen through the skin. And then there are some topical treatments as well. So some women might only find that they're struggling with vaginal symptoms to start with, and they might not feel they want to go on HRT. Estrogen can be given directly into the vagina through different routes. So there's a cream preparation, which is what Ovestin is at the bottom there. There are some pessaries available. And there's actually a ring, which is called Estring, which I think is a really brilliant product, but doesn't seem to be that well prescribed at the moment. That delivers estrogen constantly, and you keep it in for 3 months. And it's a really, really effective way of treating those sort of symptoms. So if you're interested in any of those, come and talk to me, obviously in a bit more detail later on. But thinking about the benefits of HRT, so why would you want to take HRT? So for me, the main reason is that it is the most effective treatment for menopausal symptoms, and this has been proven with significant amount of studies. It's by far better than anything else you can take, and it does have other benefits as well. So when we think about estrogen particularly, we're thinking about it helping our bodies, it helps our bones, it helps our heart, and it helps our brain. So these are things that it's going to help with potentially. So we know that it is really effective in helping maintain bone density, and it is actually a recognised treatment for osteoporosis now in women aged 50 to 60. We know that it helps with cardiovascular changes. So if you start HRT close to the time of your natural menopause, it helps protect your heart and blood vessels. I don't know how many of you watched the Davina programme that was on in the summer. They spoke quite a lot in that programme about the association with dementia. Now, there's not enough evidence at the moment to say that HRT prevents you from developing dementia, and I would never give it to somebody just for that reason. But we do know that estrogen has a really important role in the brain, and we do know that women that go through an early menopause are actually at higher risk of developing dementia if they're not treated effectively with HRT. So I think there will be more data coming through that continues to support this. So it's kind of a really hot topic. I wouldn't say to you to use it solely for that reason, but it's maybe just something to think about as well. Colorectal cancer, there has been data to show that actually that is reduced in women that take oral forms of HRT. Again, it's not a reason to just take it for that, but it's another potential benefit. And actually, when you look at mortality rates for women that use HRT actually have lower overall mortality rates than those that don't, which is quite an interesting statistic, I think. And it's most likely because of all these other health benefits that it gives you. But it does have some risks as well, and obviously we do have to take that seriously. And most women probably do worry about the breast cancer risk. That's probably the biggest thing that most people will talk to me about. I think this is a really good diagrammatic picture that shows what the risk of HRT in relation to breast cancer is, in putting it into perspective with other things, because I think that's the most helpful way of thinking about it. So women aged 50 to 60, baseline risk of getting breast cancer is about 23 in 1,000. So without any other risk factors, that's roughly what the rate is. If you look at women taking HRT, so the second line down, there's an extra 4 women in 1,000 that will be diagnosed with breast cancer as a consequence of taking HRT. There's no evidence it causes it, it just increases the rate of diagnosis slightly. So it goes from 23 to 27. If you compare that to drinking 2 units of alcohol a day, which the way I pour a glass of wine, I think it could well be more than that, that actually increases your chance of breast cancer more than HRT does. It actually goes up by 5 cases in 1,000. And then the biggest risk factor, which is this one here, that is obesity. So anybody who has a BMI of over 30, you're more than doubling your risk of getting breast cancer. It goes from 23 to 47. So it's just about trying to put it into perspective. I'm not saying it's without risk, but there are lots of things we do that probably are more risky. And everything in life has an element of risk involved, and it's about weighing up those pros and cons, really. There are some other risks just to think about. So blood clotting. So when you take an oral form of HRT, there is a slight increased risk of blood clotting. It's still very small, but it's something to think about if you're maybe at a higher risk of that already. I mentioned about the cardiovascular risk earlier, about HRT being protective. That is important if you get it at the right time. If you leave it a little bit too long, so if it's more than 10 years after your menopause, or if you're over the age of 60, the risk does start to slightly increase, actually. So it's just, again, it's about the timing of things a little bit. And then there are some other slight associations. So ovarian cancer, there's about 1 extra case for every 5,000 women using HRT. But, you know, that is really quite small risk, really. So if you are considering HRT, I do think it does need to be an individualised approach. There isn't a one-size-fits-all. I do think body-identical HRT is probably the most useful form of HRT that is available. And actually, the slide I showed you to do with breast cancer comes from, sadly, the very old-fashioned forms of HRT, because that's where most of our data has come from. There are new studies, and I'm hoping I might be able to get a new picture at some point that shows that body-identical HRT in relation to breast cancer has a neutral risk for the first 5 years of using it. So all that data I showed you is worst-case scenario for kind of the older forms of HRT. So this is why we're more interested in body-identical. But it's about individualising it, so there might be reasons why you might want to choose one type of product over another. And I would think about maybe getting sort of specialist input if you are a little bit unsure. And you know, maybe when you go to your GP, ask to speak to the GP that has more knowledge of HRT so that hopefully they can give you the best up-to-date advice. Because, you know, general practitioners can't know everything about everything, and they're going to be people that have a special interest in certain areas, so worth always just checking who that might be in your own practice. And then I've just put this slide up. I've got a table in the room that looks very bare compared to everybody else's. I am mostly interested in HRT, that is my kind of main area, but I recognise it's not for everybody. And so I do have a more holistic approach when I see people in my clinic, and I felt like I was advising people on supplements to take, and I felt it was a bit of a minefield out there. So I have actually developed a supplement myself, which really contains the key things that I think are important. They're going to be available to buy soon online. It's not up and running at the moment, but I have got some with me today if anybody is interested at a slightly reduced price. But that's not the reason I came. I came mainly to talk to you about HRT, and I feel like I've whizzed through it very fast. Oh, right.
One question to start. Can you take men with HRT?
Sorry. Yeah. So it's sort of for anybody really. So with HRT, it's absolutely fine. It does contain a phytoestrogen, so it has a slight estrogen-like property. So it is marketed a little bit for people maybe that haven't decided to take HRT yet, but it's perfectly fine to take in combination. And it does have other things in it that can be really helpful as well.
I saw your hand go up first.
Yeah, I was just wondering, with the HRT, is there a risk of weight gain?
So weight gain is, I often get asked that. So there is no evidence that HRT causes weight gain. A bit like contraceptive pills, people often think it makes you put weight on, but actually there's very little evidence to show that. Weight changes are very common around menopause, and I think sadly people often like to blame something, and so might blame the HRT. But actually, yeah, there is no evidence to show it causes weight gain. If anything, it can help with kind of controlling your metabolism a little bit better. So might potentially help you manage your weight better. I don't ever market it to people as this will help you lose weight, but it will not make you gain weight either. It can sometimes in some women cause a bit of fluid retention, so that potentially can make it feel, like on the scales, potentially looks like you might have gained weight, but it doesn't increase sort of levels of fat in the body or anything like that. So I often say that actually that's not a reason, yeah, if you're worried about that, not to get too concerned really. Yeah, so that's very controversial, isn't it, at the moment? I'm sure on Davina's programme, they probably were saying you should take it forever. And I know some doctors and menopause specialists do have that approach, that you should take it forever. Again, I think there is no definite time limit that you should or shouldn't take it for. So in my approach, I would see people on a yearly basis, and we'd make a decision together as to where they sit on that benefit of risk and sort of benefit, really, that balance of risk and benefit. Probably most women take it maybe for around 5 years. I think that stems a little bit from the data that showed an increased breast cancer risk after about 5 years of using it. But there is no hard and fast duration that you must or mustn't take it for. It's an individual choice, really. And yeah, that's how I approach it.
If you've had a hysterectomy
Yeah.
and they've left your ovaries,
Yeah.
and the ovaries aren't really functioning, what sort of line of...
Yeah, so if you've had a hysterectomy, as long as it wasn't for endometriosis and you had severe endometriosis, you would just be given estrogen. So the reason for the progestogen is to protect your womb lining. So if you've had a hysterectomy, your womb lining has been taken away. So you don't need to have that. The ovaries, yeah, it doesn't matter. Sometimes when you've had a hysterectomy and the ovaries have been left, they can carry on functioning, but sometimes they do kind of stop functioning a bit earlier, maybe because their blood supply has been affected by the surgery, lots of different reasons. But yeah, most of the time you could have just estrogen.
So can I just ask you, is there an instance where HRT doesn't work?
So yeah, so for some women they do struggle with the hormones. Progesterone, I often find, is the hormone that causes most of the side effects, which is frustrating because it's often the thing that's not actually giving you most of the benefit. Some women are really sensitive to hormones, and it can be a challenge to find the right product. I'd like to say that most of the time we can find something that works. It might be we need to adjust the dose, it might be we need to adjust how you're taking it. The progesterone can be given in different ways. So often there are ways around it. Sometimes it's done out of the license of HRT, so that becomes a bit more tricky, and might not be something that in general practice is that easily done. But sadly, some women are just really sensitive to hormones, and ultimately they find that they get more negatives than positives and decide to stop taking it.
So have your eyes, just be open to the idea of...
Yeah, the Marina is really good.
How long does it last, the progesterone in the Marina?
So for HRT purposes, it's licensed for 4 years, but actually the guidance from the Faculty of Sexual Health is we use it for 5 years. A lot of the time contraception is for 5 years as well, but it depends a little bit about when you had it fitted. But for HRT purposes, we can use it for a maximum of 5 years. But then you can have a new one put in, you can just have it changed. And it is a really good way of doing it. And if you're someone in perimenopause who still needs contraception, it can be really useful for that. If you're someone who's had a lot of heavy period problems, it's a really good option for that. So yeah, I'm a big fan of it. Sadly, the difficulty accessing it, I don't know what it's like here. In some parts of the country, it's tricky.
We always ask my GP, the GP says, put your life story in the Ask My GP box, and then whoever's looking at those requests can really signpost it to the person who knows the most about HRT.
Yeah, I think that's a good way of doing it, isn't it? Yeah.
HRT and diabetes.
Yeah, so there's no real reason that you can't use HRT if you've got diabetes. Obviously, we'd want to make sure your cardiovascular health is being optimised from your diabetic control side of things. And it might be that we'd want to consider maybe a transdermal preparation for someone if they've got blood pressure problems or other issues with their diabetes. But yeah, it's absolutely fine to use.
We just seem to have got through the stock issue, but we're going to hopefully generate another stock issue with this event.
Yeah. I think the difficult,
Yeah, I think that's time
it's
up, I'm afraid.
yeah.
So,
No,
thank
thank
you.
you.
Thank you very much.
Yeah.